Chapter 1 introduced the behavioral approach to psychology, which focuses on the role of the environment in one's behavior. That behavioral approach also served as the foundation for concepts in learning, such as classical and operant conditioning. When applied to therapy, behavior therapies are based on the learning principles of classical and operant conditioning. In its simplest form, behavior therapies assume that abnormal behavior is learned. Therefore, behavior therapies use learning principles to reduce or eliminate maladaptive behaviors and replace them with more well-adjusted or adaptive responses. There are several types of behavior therapy. There are two categories of behavior therapy, ones that use classical conditioning and one that use operant conditioning. Systematic desensitization is based on classical conditioning, which involves learning by association. The purpose is to treat fears, specifically phobias. Let's break down what systematic desensitization means. Systematic is referring to a step-by-step process. The prefix DE means the lack of, and the root word of sensitization is sensitivity. In other words, the therapist wants to make the client less sensitive to a fear or phobia by using a step-by-step process. The therapist will first use relaxation strategies, such as deep breathing and meditation, to calm the client. Then the therapist will have the client confront the fear while experiencing a gradual series of anxiety-producing situations with the object of the phobia. In the film Batman Begins, Bruce Wayne developed a phobia of bats as a child. Later, in order to become Batman, Bruce had to confront his fears by entering the cave and exposing himself to the bats. Aversion therapy is based on classical conditioning. The root word of aversion is to avert, or it means to avoid or strongly dislike something. The purpose of this type of behavior therapy is to stop an undesirable behavior by pairing it with a painful, sickening, or aversive stimulus. This type of therapy can be considered a form of counter-conditioning, where the client is conditioned to avoid the undesirable behavior because of the painful consequences. Techniques can vary from minor to harsh. Historically, electric shock was used as a punishment to get mentally ill patients to behave, as shown in this photo from the film One Flew Over the Cuckoo's Nest. In this unfortunate scene, the patient McMurphy is being shocked because he didn't follow the rules. Medication that causes clients to become ill is another technique. The medication antabuse is given to patients who are dealing with alcohol addiction. When the patient drinks alcohol, the medication makes them severely nauseous and violently ill. Another less serious example would be when helping children stop thumb sucking or biting their nails. The common type of aversion therapy here is using nail polish as a deterrent. Most students have experienced behavior modification and never realized it. This type of behavior therapy is based on operant conditioning, or learning by consequences. These consequences involve using reward and punishment for the purpose of modifying behaviors. There are several techniques. Timeout is most used with children when they are removed from the situation to stop undesirable behavior. Children are usually sent to their room or placed in their crib or playpen, as Jimbo is shown doing in this photo from the Boss Baby. If you've ever been grounded, that's an adolescent version of timeout. Now, do you remember elementary school, where your teacher would reward good behavior with prizes? A token economy involves a person of authority rewarding appropriate behavior with a token, like a sticker or a star, and then those same tokens are traded in for a larger prize later. Applied behavior analysis is a type of behavior therapy that is focused on improving social skills and adaptive learning skills for clients who are diagnosed with autism spectrum disorder.